what the case is about? Yes.
Two students acting in an unprofessional manner.
Definitely acting in an unprofessional manner. What was unprofessional about what they were doing? Yes.
Commenting on patients.
Commenting on patients. They're actually violating a huge law. Do you guys know what that is?
Patient confidentiality.
Patient confidentiality. So that goes with HIPAA. It's actually a federal law. So what else? So they're making fun of patients. Are these just any patients?
No.
No, they're special needs patients, right? So special needs patients fall into a special category called a vulnerable population. And when you have a vulnerable population, the ethical principles actually take on an even deeper meaning. And those principles especially are autonomy. Autonomy is giving the patient the right to consent, to choose. Making sure that the patient has informed consent. If the patient doesn't have the capability of making informed consent, their caregiver, making sure the caregiver knows. Also fairness, not just treating everybody the same, but providing the best quality of treatment. Do you think they were doing what they should have done with those two principles in terms of fairness? No. And autonomy, how's that? Because the patients don't have the capacity, it seems like. How did they violate that?
Well, they wrote about them without their consent, and it already made them any idea that they were doing.
Right. And they weren't, they didn't have consent and they didn't know. Was what was written about them even politically correct? No. Retards, helmets, special buses, all really derogatory things, right? So what do you think about Stephen and Matt pursuing the school for their First Amendment rights and right to privacy? Do you think they have a right to do that? Anybody? Well, actually, yeah, they have a right to free speech. They do. Everybody has a right to free speech. Yes?
I think they have a right to free speech, but the school has a right to not teach them if they don't want to, if they don't see them fit for their
Absolutely. If they don't fall into a code of conduct or follow the code of conduct, right? Did you guys know that anytime you post on Twitter, Facebook, or any of the other social media sites, you automatically give up your Fourth Amendment? You guys even know what your Fourth Amendment is? It's the right to privacy. Once you post on there, you are consenting to give that up entirely. You've lost it because you're posting on a public site. So as far as right to privacy goes, they've lost that. So that's not an issue. The issue of right to privacy is actually the patient's issue. What about, I have another question, I have questions right here. Do you think that because of this, the university should now impose social media restrictions for every student?
What kind of restrictions?
You tell me.
I don't think it's fair.
Yeah, I mean, a few bad apples can't ruin it for the bunch, right?
That's a really good question. A few bad apples can't ruin it for the bunch. So let's think about that. You guys are all very intelligent. You wouldn't be here. You all seem, on the surface, very honest people. But let's say, for example, we're all going to put you in a big glass of water. Okay? This giant glass of water. You guys are all in a tank right now. And you have a bad apple. And that bad apple drops ink. Every time they do something that's unethical or unprofessional, what happens is the ink hits the water. It spreads. So what happens to a few bad apples? Yeah, not to mention you guys are all sitting in it. all of you in the pre-dent honor society are sitting in a tank of tainted water because 2 people did something they shouldn't have done. That's pretty crummy, don't you think? That's what being in a profession is about. You're all in this together. Your success is his success. My failure is your disappointment. That's pretty strong, right? That's why professionalism and ethics are so important and important to get down now. So knowing what we just talked about, do you think it's fair for the university to impose restrictions? As a professional, wouldn't you want that? Maybe as an individual, no. I hate rules. I absolutely hate rules. If you want to make me mad, tell me what to do. Or tell me I can't do something. It pushes my buttons. I hate it. But when it comes for the collective good of what I do, of my kids, then yeah, it's kind of important, right? So being able to separate ourselves as individuals and as professionals, also important. And Matt and Steve failed to do that. So what do you think some of the benefits are, though, to using social media in your practice? Because it can be very useful. Advertising. What else?
PR.
Marketing, PR. Think about this. Before a patient comes to see you, they Google you. They pull up Yelp. What's your name?
Steve.
Steven. They see Dr. Steven, and they say, this office is great. Everybody's so nice. Everybody's so wonderful. You walk in, and he's got these huge TV screens, and they have the latest technology, and it shows you what's available. They have a comfort menu. I can opt to order a blanket because I'm cold, or I can ask to have headphones or an eye mask. This comfort menu is fabulous. He's the best office ever, right? So that's the review on Yelp. So they go to drsteven.dentistry.com. And there on his website, everything pops up. There's the comfort menu option. It shows where he got his degrees from. It lists his hygienist, pictures, a bio, right? So then they see he's got a Facebook page. So they go to Facebook. That Facebook page is very similar. There's a picture of a patient who's in Hawaii smiling. Thank you, Dr. Steven. My trip was so much better now that my tooth was fixed. Right? These are all consistent messages that are coming across. You have now created a virtual experience for this patient as your patient before they even set foot in your office. That's really powerful, right? So what happens then if that patient comes into your office and the TV is hanging off the wall like this, and that comfort menu that they get has a big blotch of spaghetti sauce on it, and the office assistant or the office manager or front office person doesn't look up when the patient walks in, and they say, sign in, sit down, I'll be with you in a minute. What happens to your credibility? What happens to that patient's virtual experience? It's gone, it's blown. You're screwed, right? They're gonna go onto Yelp and say, this is all a lie, this place is terrible. But then what happens if the patient walks in, I didn't mean to slam the pen down at you. If the patient walks in and everything's pristine and beautiful, and they're greeted when they walk in by the front office person, good morning, thanks so much for coming in today. I'll have you sign in and then we'll get to some paperwork. Can I offer you a bottle of water? Right? This patient is so happy. And then they're more comfortable. Right? So you've just built patient trust. You followed through with your integrity because you've matched what you've advertised. Your Facebook page matches your website, which matches the reviews, which matches your office. So it can be really helpful and beneficial. It's also good for staff morale. think about it. You guys are hiring, you probably have one front office person, maybe an office manager and a receptionist. So 2 people up front. You'll probably have 1 to 2 people in the back, 2 dental assistants and a hygienist. That's 5 people you're responsible for. That's 5 people you don't want coming in just to get a check. You want them invested. You want that psychological contract to your office. If you have an employee of the month and you post it on Facebook, that's kind of a big deal for somebody, right? Makes them feel good. Makes them feel acknowledged. If you have somebody's birthday and you take pictures and you post it on Facebook, with their permission, of course, there's another disclaimer, it's a good thing, right? So Facebook and social media can be good when used in the right ways. Should you ever post pictures of your patients on it?
No.
Even if you have their permission? What if they post it?
It's okay.
It's okay. If one of your patients posts a picture and tags you, it's okay because essentially they're the ones doing it. They've already given up their right to privacy, so it's okay. Do you think the school did the right thing by expelling them? Yeah? Anyone disagree? I kind of disagreed. I didn't think they needed to be expelled.
I agree.
That's good.
Yeah, it sounds harsh.
It was kind of harsh. I thought so too. I thought remediation.
I think expelling them as a first step was harsh. Yeah.
Yeah, I did too.
And if anything, the way that it was explained in the paper,
Uh-huh.
I would have had the dental school expel them for violating HIPAA, not for posting on Facebook specifically. You know, like if it was a violation of privacy laws, then that makes sense.
Right.
But for posting on Facebook and messaging with their friends, I mean,
Yeah, no. Okay, well, any questions? All right, well, thank you so much, you guys.
if you